This short video is designed to show you how to enjoy safe skin-to-skin care with your newborn baby, why this is important, and how to dress and cover your baby afterwards. After your baby is born, you will be offered your baby immediately, or as soon as possible, for what is called skin-to-skin care. This is when your naked baby is placed directly onto your skin, usually wearing only a hat and a nappy. Your baby will be covered with the correct number of sheets and blankets to keep your baby at the perfect temperature. You should be able to see your baby's face at all times, and baby's neck should be nice and straight with their head upwards so they can breathe easily. Your baby's temperature and your temperature will be checked within the first hour of life, because if you are too hot or too cold, this can impact on your baby. Your midwife will also check the temperature of the room you are in to make sure you and your baby have the correct number of layers on. Safe skin-to-skin care is calming for both parent and baby. It helps strengthen early feeding cues for baby. It helps your baby stay at the right temperature, and it is a beautiful time to bond with your baby and get to know them. Birth partners can provide skin-to-skin too. So what happens next? Each parent and baby are unique and will all do things slightly differently. But as a general rule of thumb, there are 3 key points to keep in mind about when to get your baby dressed. These points are: number 1, after at least 1 hour of safe skin-to-skin care, or number 2, after baby has had their first feed, or number 3, when mum or dad or your other birth partner is ready to. This is a time when baby may start to get cold if they are not dressed and covered properly. So try not to leave your baby naked if you are not doing skin-to-skin care anymore. Dress your baby in a vest and a baby grow, and then either 1 or 2 0.5 tog blankets, depending on the room temperature. For example, if the room temperature is 21 degrees, your baby will need 4 layers over them, like this example. A vest is 1 layer, a baby grow is a 2nd layer, and then each unfolded blanket counts as another layer. If you fold your blanket in half, this counts as 2 layers. There are room thermometers and easy to follow posters in all delivery areas at the Rosie, so you can work out how many layers your baby needs. Sometimes your baby may need more or less layers if their temperature is slightly high or low, but your midwife will check this and help you work it out. If you think your baby feels too hot or too cold, please ask your midwife to check your baby's temperature. Don't forget your baby's hat. This is a really good way to help your baby stay at the right temperature after they are first born, because babies lose a lot of heat from their heads, but they can also make baby too hot if they are not taken off when they are not needed. The best way to work this out is to feel your baby's chest and back with your bare hands to see if they feel like the right temperature, and ask your midwife for advice on when to take your baby's hat off until you get used to how your baby feels. These posters are in every delivery room at the Rosie Hospital and show how to do safe skin-to-skin care, when to stop doing skin-to-skin care, and what to do next. There is a guide for how many layers your baby will need on them, depending on the room temperature you are in. And of course, your midwife will be there to support you and your baby and make sure you have everything you may need. If you are unsure about anything at all, or you want to check if your baby is the right temperature, your midwife will be able to help you at any time.